So we like to ask people, particularly women, how many lines will you tolerate around your mouth? And the answer to that question is invariably 0. Unfortunately, that is an area that ages rather quickly and sticks out. It's in the center of our face. People can call it smoker lines, they can call it straw lines, they could call it whatever they want, but no matter what you do, just talking, eating for years and years, people are going to end up with lines around their mouth. And it's been one of the harder things to treat. The best treatment is probably a strong fractionated CO2 laser, but oftentimes patients can't afford the time it takes to heal there. It takes about a week or two before you could put makeup on, but then it takes another few weeks for the color to fade back to normal. My preferred treatment of treating upper lip lines is actually to use microfocused ultrasound, or Ulthera, on the upper lip and lower lip. And using that, we usually see some improvement after about 3 to 4 weeks in those lines. There's some immediate swelling, but after 3 to 4 weeks we see improvement. And I ask patients to come back 3 to 4 weeks later, and then at that point, on top of having had the Ulthera, then I will inject a filler with the finest needle, a 32 gauge needle that we have available, both in the lines and perpendicular to those lines. And by doing that, we find that we get a long-lasting result. Now, the injection has to be intradermal. It takes a long time. It's very, you have to be meticulous about it. But when doing it correctly, we get wonderful results. The two products that we use there are Bellatero. I actually prefer to use Juvederm, but dilute it down in half, and that gives you a wonderful result.